and we'll let you know how everything. Please stay on the call if your schedule allows. But we're gonna go to the next panel, and we'll let you know how everything turns out. So thank you again. Awesome. So now we're going to move on to a panel talk a little bit about innovation. And so we have four amazing individuals with us today: Dr. Gamble, Dr. Akande, Dr. Watkins-Moore, and Omo as well. And so I'm going to let you all do your intros again, some quick name, organization, what you do, a minute or so version of it, and go from there. And so Dr. Gamble, are you there?
I'm here.
Okay.
Well, I appreciate you all inviting me to be a part of this panel. The COVID panel was a lot of heavy hitters there, and you guys were fantastic. So this is really, really difficult to follow up with. But a little bit about myself. I'm a PhD in biomedical engineering. I did my PhD at Washington University in St. Louis. Was focused on neural engineering, was very interested in how do we allow the brain to control new prosthetics. And about halfway through my PhD program, there was a report that came out at WashU. It was called the For the Sake of All report in 2014. And there was some really striking data in there about disparities here in St. Louis, that you could be in a black zip code and drive 15 minutes away to a white zip code, and it resulted in a 20-year difference in life expectancy. And so that report kind of changed everything for me. Neurotech didn't seem that important anymore. And so I really changed everything I was doing to focus on accessibility to healthcare. So my company, Resilient, we are a robotic telehealth company. We had an insight a while ago about telehealth that, video conferencing is great, but it is limited. There are many things that specialists cannot do through video conferencing today. The key thing being physical exams. So if you go to see your ENT doctor, you want your ENT doctor to look in your ear. So what we've done is we've built a telerobotic platform where doctors can actually control medical devices over the internet. And as a patient, you could go to your local CVS, Walgreens, Kroger, whatever it may be, and get direct access to your healthcare provider no matter where they are.
That's nice. Dr. Akande, and please, is that the right way to pronounce it?
My name is Irewole. Or okay. You could just call me Wale. Like okay, rapper, but with an L.
Gotcha.
And I'm actually not a doctor. I'm an engineer. So
okay.
Yeah, so I'm the co-founder and the CTO of City Health Tech. So we're a public health company, and our vision is more or less to live in a world without disease outbreaks. I think we believe we can use technology to build healthier communities and just mitigate the spread of diseases. So over the last 3 years, I used to work with WPG Holdings. It's one of the largest semiconductor distributors in the world. And while I was there, I worked with about over 250 customers, 400 different projects, and just building like unique electronic devices, designing in the best products into the applications, right? And I think when I started City Health Tech, my mindset started shifting from just like, making things for toasters or designing things for like a public information display. I started thinking, so I have all of this engineering knowledge, how can I actually apply that, to make a positive impact on society? So since then, 2 years ago, I joined City Health Tech and rose up to become the CTO. And yeah, it's been a fantastic experience for me. And it's interesting listening to Jeff talk about like his startup, because I'm just thinking about what he said, and I'm like, it's more or less like, what I used to help everyone do, anything along the lines of, the Internet of Things, computer vision, and all of those systems. So that's sort of what my expertise is in.
Nice. Is it Dr. Watkins-Moore?
Yeah.
Okay.
Yes, it is. Thank you, Joey. And it was great to hear from everybody. I enjoyed that first panel. Really, really great discussion. Again, my name is Dr. Cheryl Watkins-Moore. I am a physician by background. I'm from Chicago. Did my training. I think he dropped off, but the gentleman that was on from Chicago did my training at Cook County, and then went to St. Bernard Hospital, smaller hospital in Chicago. Practiced for several years and went back and got my MBA from Northwestern, and then did a corporate track in healthcare. My last corporate position, I was VP GM for Merck out on the East Coast, ran a $100 million business there, and then came back into the St. Louis market and got engaged with our startup community, which is, I don't know how much you guys know about St. Louis, but it is touted as one of the top 3 cities in the country for startups. And actually, we have 3 innovation districts. One is very well known across the world, Cortex. So I work with one of the founders here, organizations here in the community called BioSCL. It was a 20-year build for our startup community, and I lead our inclusion initiative here for the region. So Jeff and I know each other very well, but our inclusion initiative focus is to engage people of color, women in immigrant populations, to support them as they build STEM-enabled ventures here in our region. So I've been leading that for the last 7 years. Just some stats, we probably had over 1,300 participants in our program. We've trained about 400 plus founders, and out of that, we've supported 8 founders that have gone on to raise $50 million in capital. I'm a serial entrepreneur as well. So I'm on my 3rd venture and actually looking at a 4th. One is, my first one was a software tech company, health tech company. I also have a podcast that has actually been acknowledged here in our region as an innovative podcast to listen to, Entrepreneurially Thinking. And my business partner, who is a patent attorney, and myself, we are developing a vertically integrated medical cannabis company, and we've raised about $2 million in capital to build it. I was just recently invited into a cohort. It's a national cohort where they look for serial entrepreneurs that can help solve wicked problems. And it used to be called the 10-10-10 program out of Denver. Of course, there's only 2 Black people out of 15 entrepreneurs that they selected. And it was interesting for me to get involved because these are wicked problems around COVID. And I was very interested in how do we solve some of these wicked problems, especially as they affect the minority community. So these topics had to do around future of learning, future of health, and future of work. So I'm in the process of evaluating a technology platform, because I think that all the issues that we raised previously are important for our community, but raising our folks out of poverty and out of these first line jobs, that's where we need to go. So I'm looking at building a technology platform that can help reskill and upskill people in these low wage jobs so they can get access to opportunities in AI, tech, and automation. So
nice. And Jeff and Cheryl, so Jeff, my wife went to WashU, and Cheryl, a partner organization of ours is We Power. We're both part of Village Capital.
I'm on the advisory board for that.
There it is.
So you and I need to talk, because the other thing, I do teach. So I have taught entrepreneurship at Northwestern Law School, and I am teaching a summer course at Harris Stowe for entrepreneurship. So Joey, yes, we definitely need to connect.
I love it. So is it Omo? Then you're on mute.
Yeah, it's Omo.
You have a lot to. I don't know if you could follow this. I'm sure you can, but that the previous 3, so
I probably can't, but I'll try my best. So first off, thank you for the opportunity to be here. I believe it's very relevant and important that we discuss these things. So I'm really glad to be a part of this panel. So my name is Omo. I'm a recent MPH graduate from Columbia University. I focused in health policy and management with a certificate in health communication. My background before this was in journalism, but I'd always been interested in health and wellness. So I wanted to tie it to the health communication perspective to understand what it means for the community to be healthy, not just on an individual basis. So I focus on studying the social determinants of health to understand the factors that impact how people perceive their health and how they can adapt or adopt healthy behaviors what are the barriers and facilitators to changing their health behaviors? How can we increase access, especially for vulnerable populations, in terms of how they can improve their health, but also if they're given the right resources to enable them adopt those healthy behaviors. So recently I started working with City Health Tech with Wale, and I'm their public health specialist. And I focus on tying health education to technology in order to improve that access and increase it to vulnerable populations. And we're starting in Chicago, and we want to focus on city health for multiple states. So that's where I'm at.
Awesome. Let's get into it. So you all have touched on a number of things, from a lot of deep technology, robotics, artificial intelligence, the part around machine learning, innovation and storytelling. I think is an opportunity. Let's talk about some of the trends that you all are seeing in general around innovation, and then also if you're able to go a little bit deeper toward the medical part of it as well. So Jeff, I'll kick it to you first.
Yeah, so I would say, I guess I'll focus in a little bit on the medical healthcare space. So I would say COVID has really changed the landscape for healthcare and how technology is being implemented and utilized. Hospitals, in particular, healthcare systems tend to be fairly conservative and move fairly slow. So when it has come to adopting new technology, they've been very behind. But COVID has really accelerated everything. So I would say a lot of healthcare systems now have a digital first mindset, or at least starting to think that way. Whereas if you had asked them a year ago, they wanted to see, what are the other 10 health systems that you previously worked with in order to do an implementation with them. And then kind of within that digital umbrella, I would say probably two of the biggest areas right now. Telehealth is a very hot one. Basically, every health system in the country has implemented some form of telehealth solution, especially in the last 6 months. And then I would say AI comes up a lot in thinking about like clinical decision support, in being able to do diagnostics. And in that topic in particular, there is a lot to be said about, racial bias, and what algorithms can work with which people. A lot of companies have stumbled when it has come to that. So I think that's something that I hope as more people of color get involved in that space, that I think they're able to steer it in the right direction.
Nice. Wale, Cheryl?
Yeah, so I can actually address that a little bit, and I'll address it from two angles, right? So while I worked in electronics distribution, the big thing in our industry is that everyone wanted a medical design, right? Because these are like long design cycles. It takes like 5 years to design, and you'll be designed in for 10 years. And I never really understood why that was something that was lauded, right? I'm like, so you're telling me that new technologies come out every single year, for medical companies basically designed for 5 years and use it for like 10 to 15 years without changing anything, right? That was something that always just seemed like a disconnect as someone that wanted to be an innovator. And I was always curious why was the case, right? So when I actually started my company, when we started our company, I started thinking, what are the ideologies behind innovation, and how do they really affect, like, the medical community and health? And the big thing I realized is that a lot of innovation around like healthcare has been done as reactive rather than preemptive, right? So we are always trying to create like technologies that fix in a problem after the fact, whereas like not a lot of work is being done to prevent things from happening. And I think that's where like innovation within like healthcare really needs to change, because a lot of people are talking about, oh, we want to come up with like a new vaccine or like a cure. And a lot of pharmaceutical companies are making a lot of money making like medication and drugs. But the hygiene and the education that actually needs to happen before people get to that point where you spend billions of dollars fixing problems a lot of innovation isn't going into that. And I think coming from like Nigeria, or like, you know, being a Black person in America, you start thinking about, okay, what does that look like trying to build that innovation? Everyone here that has done anything within the design space knows about the balanced breakthrough model of innovation, right? So you talk about the feasibility of doing something, you talk about the desirability, the people want it, and you talk about the viability. And one I found out when I was working on my company is that the people that can pay for certain services when you discuss medical are usually like, you know, rich white people, right? And for that particular reason, you're basically designing products that people can pay for, because that's the traditional idea of the balanced breakthrough model of innovation. So who can pay for this complex solution I have, and how can I make money off it so I can keep making the impact I want to make? So for us, we had to change that entire approach, right? So we're like, we have a product, we know we can pull it off. We have a group of people that need it. Can we build a product that can actually scale across communities? That's the first thing. And the second thing, can we actually get them to, you know, adopt, you know, the product or the value that we're adding? And being intentional about our business model to make sure we are bringing people into the loop. We no longer can go down the path of like the traditional way of innovation, right? Without accounting for the discrepancies you'll find within communities. You know, and you can talk a little bit more about like the education. And I think Omo probably has a bit more knowledge about that than me. So I'll let her talk about that. And yeah, and the trends that you're seeing right now, everyone is talking about contact tracing, and everyone is talking about like, you know, creating like all of these apps that will keep people apart from each other, and all of those solutions are after the fact. Whereas like what we're working on is building a company that can actually teach people proper hand hygiene, right? You're meant to wash your hands for 20 seconds at least. How many people wash their hands properly? So before the COVID-19 pandemic, our statistics were 95% of people do not wash their hands properly, right? Something very simple as that. And no one is trying to talk about that, but everyone is going to talk after the fact about like, hey, you want to stay 6 feet from this person. Why are you doing that? And if you're ever not able to maintain that, what are the actions you can take to actually keep yourself safe and your community safe? And I think that's the difference between how I viewed innovation before I sort of came into this space, and now that I'm actually trying to design solutions that scale across different communities.
Nice. So Cheryl, before we go to you, Alma, did you want to piggyback in terms of anything on the education part?
Yeah. So in terms of building a technology, there's so many great ideas out there, like so many. But the most important thing, I believe, is meeting people where they're at in terms of how they understand health and what they believe about how susceptible they are, like if they even understand that they're at risk in that sense. So it's a lot with, you can tell people what to do, you can throw the information at them, but it's not always enough to just inform. That's where health education comes in handy, where in health education, we utilize behavioral health theories to really understand why people behave the way that they do, and to target messages based on what they believe. For example, the health belief model focuses on people's attitudes and what motivates them or restricts them from adopting a health behavior. So do they even believe they're susceptible to COVID-19? Do they believe that they're at risk? You know, do they understand the benefits of washing their hands, for example, with what we're saying? Are there barriers preventing them? Like, can they afford soap? Do they have access to healthy bathrooms in that sense? And then self-efficacy, do they believe within themselves that they're able to carry out the health behavior, or do they just not care? And then we have cues to action. What are the things in their environment that help them adopt that health behavior in that sense? So it's not just enough to tell people what to do. Like we hear all the time, we should be healthy, we should eat fruits and veggies, we should wash our hands and social distance, but people have to understand why it's important, which is why at City Health Tech, we incorporate the health education aspect into the technology. Like, do they even understand how to use the technology in the first place? And it's a great idea, but you have to involve people in the process and make them the stakeholders in whatever product or innovation you come up with, so that they can feel like they're in control as well, and you're not just telling them what to do.
Nice. Cheryl, do you have anything?
Yeah, so I'm looking at innovation from a very different perspective. It's especially as we look at people of color and as we are creating innovation in our own ways. So there's two things I want to talk about. One is making sure that our innovators, as they are going through development, understand how to innovate. We have programming that we offer in our inclusion initiative that Jeff went through. It's called Square One, but it's a 10-week business boot camp where we are taking emerging entrepreneurs through a process to help them validate their idea and understand, do you have something that's valuable? I think Omo and Wole talked about this. You can spend a lot of time and lost time not understanding if you're meeting a customer's need or validating the idea. The other part of this is, I think, when we talk about innovation, is of course funding, and especially for folks in our communities. When we talk about funding, we usually don't get access to a lot of the different avenues for funding. When people talk about, okay, you need to bootstrap. Well, hell, if I'm only making a minimum wage job, how the hell am I going to bootstrap something that's going to cost me a lot of money to move my idea from an idea stage to a prototype, maybe having patent protection around it? That's almost damn near impossible. So in our programming, what we try to do is, if we identify you as having a valid opportunity, then I move you inside of our organization. And with that, we're providing one-on-one mentoring. And especially for our inclusion participants, again, women, people of color, and immigrants, I pay for patent protection. I pay for prototyping, because our whole thought is, if I can stand up and help a founder become very smart in how they run their business and actually create value for that business, then they can go further into our ecosystem and raise additional funding. We also, in our programming, started a venture capital fellows program, because what I saw when we talk about inequity in the venture space, when you look at venture capital funding, 2% goes to white women, 0.002 goes to African American women, and we need to change that paradigm. So what we did internally was we were thinking about starting a fund to support our participants, but instead we flipped the model and said, what we want to do is start to pipeline people into this venture capital industry, and we're doing it through our own investment vehicle that we have at BioGenerator. So we created a venture capital fellows program where we are inviting people like Jeff, who have PhDs, great background in science, to come in, and for 2 years, you're getting exposure to understanding how to do diligence, how to do the deals, become a strong analyst. And in that second year, we're exposing you to other venture firms as well. So when you finish, we hope you stay in St. Louis, but my hope is you go out into the broader, national community as a strong venture capital that can sit at any table. Because until we can start to change how decisions are made around venture capital tables, we will not get access to those dollars. We brought Arlen Hamilton here to St. Louis. Arlen Hamilton is Backstage Capital 2 years ago for our vision event. And I invited her to a private dinner with other venture capitalists here in our region, because many of them were like, how is this Black woman? She only came into this space 5 years ago. She was homeless before that. How the hell is she a venture capitalist? This woman has Andreessen Horowitz as one of her limited partners. And what she's saying is, I am tapping into underestimated talent and investing in them. And she's growing a $40 million fund to do that. So I think for us, that is a huge barrier when you talk about innovation. And we've got to think, how do we support more minority businesses with funding opportunities in order for them to grow?
Sure. So you touched on something in terms of the innovative process, right? And so I'm really big on process. A lot of our founders are the people that are in our programs understand this. And so when we talk about innovation, I define innovation in terms of something that is A, new, and then B, valuable. And so another kind of famous quote in the startup thing, and to be clear, you know, students, when you come up with your ideas, it doesn't necessarily have to be around technology solutions, or just in the tech startup world. Oftentimes, when some of the greatest, at least most talked about forms of innovation, that nobody cares about your ideas until it solves their problem. So I think, Willie, you kind of talked about this or alluded to this earlier. So let's talk about this innovative process. When you're trying to define the problem you all are working on, and this is to no one in particular, anyone can jump in. What are some of the things that you use to define the problem, and then actually go about maybe understanding it a little bit more?
I guess I'll jump at that. I think for us, and especially in the healthcare space at large, understanding who all the stakeholders are, even around the thing that you care about. Healthcare is really, really, really complex. And it touches a lot of different people along the way. I think a lot of times, and this is to Wale's point earlier, you know, when you think about innovation traditionally, you have a consumer and you have a product, and the consumer eventually will pay for that product. In healthcare, that is 95% of the time, that is not the case. And so you really have to start asking questions about who does this touch along the way, this problem, who does it touch? Who makes decisions, and who writes the checks? And those can all be three completely different individuals, which makes kind of solving issues in this space really difficult. But I would say for us, that has always been the thing that has really helped us to kind of narrow the scope of what we're trying to solve, and be very thoughtful about who you're focusing which energy on as you're trying to solve those problems.
And I would like to, you know, especially if you're staying in the healthcare space, I feel like I've been in the space for 1,000 years, okay? Especially mentoring companies and the like. And I always tell people, first of all, in healthcare is tricky to understand who your customer is, because it is not who the end user is, it's who's paying the bills. So it could be, you know, the insurance company. If it's something that's paid through insurance, it could be the patient. So being very, very clear about who your customer is. And going back to Joey, to your question around process, I think that is so, so very important. Understanding what the need is and what are you trying to solve, for a designated need. I have folks sometimes come up to me and saying, "Oh, Cheryl, I've got a great solution, you know, that my grandmother absolutely loves this solution." I said, "Is your grandmother going to buy this product?" You need to go talk to customers. Go find those customers that you are trying to sell to and have a conversation with. And don't be afraid. You know, I have a lot of entrepreneurs that say, "I don't want to tell people, you know, my idea." Well, the only way you're going to find out if it's valuable or not is if you talk to people. And you want to talk to people in the sense of not really supporting it. As I tell people, that's what I'm doing right now. I'm going through a process again for a fourth company. I want you to poke holes in it and tell me where it doesn't make sense. You know, where does this, you know, I'm trying to validate the whole business model itself, because I've got several customers that I'm looking at on this platform. You want somebody that can really poke holes in your idea so that you can iterate. And that's what you want to do. You want to be able to iterate and be able to demonstrate why is your product superior to somebody else's. And it does not have to be new. 99% of products coming to market are not new. You know, if you're talking about the Apple iPhone, that was a disruptive technology. That happens 1% of the time. It is actually, you're iterating on somebody else's idea and either making it cost less, more efficient, or, you know, more in line with what the market is looking at, because the market is shifting quickly now because of technology.
And yeah, I think I can also add a little bit. So something interesting about what Cheryl and Jeff said that I 100% agree with is just like knowing who your customer is. I think like when my co-founder and I got into this place, we're thinking like, oh, we're going to create this new cool technology. You know, I've been building products. I'm like, oh, I have this IoT device that's going to do all of these things.
Mm-hmm.
And for us, we realized that like, oh, there are a ton of people, right, within the healthcare space that are trying to solve the particular problem that we're trying to solve, which is hand hygiene. And what it forced us to do, or one of the good things that I'm glad that we did, was actually take that step back, right, and change our solution to think about like healthcare as a lifestyle rather than healthcare as like something that is outside of your day-to-day life when it breaks, right? And for us, we decided, okay, there are 50 companies that have tried to work something within the hospitals, the medical space to track hand washing hygiene, right? For every single one of those people that decided that their customers or the person they're selling to was going to be a hospital, right? They immediately made that decision that the only customer they can get within the framework of their solution were doctors, right? Thereby saying that like, oh, those are the people that need to wash their hands. But then the challenge with that then is, even if you're not a doctor, right, your decisions affect doctors. So if your doctor goes home and then his kid doesn't wash their hands properly at grade school, right, they're already like at risk. So not just at work. So we had to take that step back, right, throw the net like a bit more wide open and like, okay, what are the other ways, right, we can solve outside of just being within like a medical space or like the healthcare space, that we can solve like a healthcare problem without necessarily like the complications of navigating different hierarchies of like solution provision, right? So you talk about insurance, like I'm from Nigeria. Anytime I see the American like healthcare insurance thing, the first thing I balk. I'm just like, yeah, nope. I do not know what a high deductible is. This is a lot of information you're throwing at me at the same time. And a lot of people freak out about that. And I think it's just like having that patience and just like, most importantly, good mentors that will actually help you actually navigate those things. They might not always agree with your idea. Sometimes they might even think it's silly. Sometimes they might think like, nah, it's not that big a deal. I know, because for 2 years of working on this product, we had people sort of look at it like, nah, it's not that big a deal. Yeah, I don't really know what you're talking about. It sounds cool. But with the pandemic, right, we went from, oh, this would be a nice to have, to be like, yo, this is very important. We need to do something about it right now. And I think that's what you want to start thinking about, right? So make sure you're biding your time. Make sure you're having an important conversation. Find the right mentors to direct in the right way. And don't be scared to receive critique. Like Cheryl said, like when they poke holes in your idea, it can only get better. You know, like you talk about when like, you know, you work out, right? You lift weights, you just like, you know, your muscles get bad, they repair themselves, they get stronger, they get bigger. And it's the exact same thing with like a good idea. Don't be scared to get critique. Don't be scared to like, you know, have it put down. Just make sure you're picking it up and working on it again.
So I'm going to push you all a little bit into getting into some numbers. So the next session we're going to have with the students is going to focus on the problem, right? So discovering the problem. And so after that, the third session is where we start to get into the solution. And we're going to focus on the problem first. And so here in Atlanta, the managing director for Techstars, Dave Payne, says, you know, the biggest fear for entrepreneurs is not that their overall company will fail. Is that no one actually cares about the problem they're working on. Like that's your biggest fear. Once you realize that, then everything else kind of falls away. And so the good thing about the students in this program, they're scientists. And so it's my belief that, you know, early on in the startup, it's just one big science experiment. So you have hypotheses and things of that nature. You have a set of assumptions about the problem you're going to work on. You're going to develop a solution for, or the value derived from the problem. Then you're going to develop a solution that delivers that value. So the first part, typically, I'm not going to get into any tech language per se, but the first part when you come up to generate a solution is discovering the problem. So let's talk a little bit about either the problems that you all have discovered, the process and to get if we can get just highly detailed on the number of people you had to actually talk to, and maybe some of the key learnings you learned along the way. Oftentimes, and I'm going to ask the question in a second. Oftentimes, what we see is that the initial problem you set out to solve is not the one you ended up solving in the end. So, can each of you all talk about your process for discovering the problem? Maybe how many people you actually talked to, and maybe some of the key learnings from that. And if you haven't necessarily done a problem, maybe some of the other people you've seen in the same area.
Mm-hmm.
I can start with that. So the problem we started with was that there are 1 billion cases of the common cold in the US per year, right? This can lead to over like $100 billion of US GDP lost, right? That's the problem that we started with. We're going around with this huge number, right? And we start our discovery process. So we're calling people, we're pitching every single person, talking to them about the problem. The problem is that 95% of people do not wash their hands properly. The right amount of time to wash your hands is for 20 seconds, but people on an average used to wash their hands for about 7 to 8 seconds max, right? So we're like, we want to build a solution that actually helps people get to that 20-second mark, because that's actually what makes them wash their hands properly. So as we started talking to more people, we've interviewed over about 200 people, right? So as we started the conversation, this is how it usually went. Oh, that's interesting. I knew that. That's singing the happy birthday song twice. Oh yeah, but like, no one really does that. Does it really matter? So when we started having that conversation, we realized, oh, we need to narrow that down a little bit. That's when we decided to focus on schools, right? So within schools, there are like 1 million days of school missed around the US every single day. And this is usually due to preventable illnesses, right? So we decided, okay, we have a more controlled space with schools. We can go into schools. We can separate things by classes. We can actually engage with school nurses, principals, ask them like, okay, what exactly is that problem with preventable illnesses and how can we help you with? And that's when we actually discovered like the case of absenteeism. So schools lose between $30 to $100 for every single day a student misses school. And what then this leads to is there's a spiral effect, right? So a kid miss school in, let's say, a low income neighborhood. They miss one math class, their parents miss work, and then they miss a second math class and they're behind. Their parents don't have enough money to hire a tutor. Because they can hire a tutor, they actually can't get this kid caught up, and then they live their life thinking they don't know math, right? So for us, we then had to make the pivot. Before the COVID-19 pandemic, we made the pivot to go from focusing on like all these large spaces to focusing on elementary schools, right? So K through 12. And that number then looks like, okay, there are 1 million people in K through 12 schools that miss like school days. And how can we actually reduce the rate of absenteeism due to like preventable illnesses? And that actually became our problem statement. So we went from this large number, talking to people that they didn't really care. And we're like, oh, how can we create the next generation of people that actually care about this problem that we're looking to solve?
Awesome. Super insightful, like message. Listen to that. This will be recorded. Go back and listen to this again. Yeah, go ahead, Jeff, Cheryl, anybody?
Jeff, do you want to go ahead?
Sure, I'll jump in. So yeah, for us, I would agree with that the problem definition process is kind of circular. For us, what we saw was there was an issue with how people accessed their doctors. If you have a chronic condition and you may have 6 different doctors that you're dealing with, those doctors can be all over the city. And now it's up to you to have to necessarily, or, if you're a caregiver for someone, you're driving them all over the city to see these various specialists. So the question for us was, there had already been some innovation to Cheryl's point earlier. You see innovation that's already happened out there. Video conferencing was already fairly used in medicine. But when we took a deeper dive, so one, from talking to physicians who had either come into contact with telehealth or hadn't used it at all, and then actually looking up data that had been published, we saw that only, at the time, only 8 to 10% of doctors had even tried telehealth before. And so for us, the question was why? What was driving that lack of adoption? And so I would say that was probably the point at where we went out and talked to, 50 to 100 physicians, and really across specialties, and asked why they had or had not used telehealth. And what we had found is there was kind of a segregation where doctors who were more so on kind of the primary care, internal medicine, urgent care side of things, they had typically tried it, and had used it in some form in their practice. But doctors who were in kind of subspecialties, and tended to use a lot of medical devices in their day-to-day examinations, they had never used it. And when we dug deeper into that, and so what we ended up doing, kind of similar to what Wale said, we then narrowed the scope of doctors that we were talking to, and we talked to a lot of specialists. And as we got deeper and deeper into why do they not like to use telehealth, we found that the biggest issue was that they don't feel comfortable making a diagnosis remotely if they cannot perform whatever their specialty specific physical exam is on you. As an ear, nose, and throat doctor, if I can't look at your eardrum, how can I diagnose you with some sort of condition there? And so for us, we then kind of looked at, okay, what other technologies are out there currently that doctors could, in theory, use to do this? And how are those falling short? And really what we arrived at is that if you're a specialist physician, you feel that your exam is operator dependent. This is the thing that I went to med school, I went to 5 years of residency to learn how to do these things. Why do I want to rely on someone else who may not have as much training to do that examination for me, and then I have to review the data after the fact, and then bring in the patient anyway and redo the examination again? So that really kind of drilled us down to our core proposition, which was, in the end, physicians want agency, and they want control over how they are gathering data to make diagnoses. So the big thing for us was, how do we give control in real time to a physician remotely when they are doing a physical exam with medical devices, such as an ophthalmoscope to look at your retina, or an ultrasound to look at your heart. And so that really became the core of what we did at the company.
Nice. Cheryl?
Yeah, I was just going to say, there are tools that exist that it will take you through process. And one I use even today is the Lean Canvas model. It is a one-page tool. I don't know if you guys are teaching to that or not, but it is anytime I evaluate a business, that's what I look to. It's 8 segments on that. I think it has you elucidate what the problem is, what your solution is, who are your customers, what are the alternative solutions, so your competitors, what's your unique, or what's your differentiating feature around your technology, what channels are you looking at distributing, and then of course the bottom line is the cost and the revenue, which I think a lot of people fail to think about. So you want to, that is such an easy tool to use as you're evaluating new technology, because it's quick. You should be able to, understand where the holes are in your knowledge gap. And you can take that once, and it's iterative. You can keep filling that out, and you can turn that into your business plan, so always start, there, because it's going to have you think through all the key pieces that you need to think through. And I always say, understand your market, and then understand what it's going to cost you to build this business, and what's the expected revenue and time frame. How long is it going to take you to reap benefits from that?
Sure. So we are at time, but I do want to get your quick 25 second version moonshot idea around COVID-19, and even for on if you want to just make it more specific to Gen Z or so. Going to start with Amo.
So for me, I would say, think about what my sister used to tell me when I was trying to figure out what I wanted to do in life. She asked me, what is your offering to the world? You know, how can you harness your superpower and give back to people in terms of whatever you're good at or what you're curious about, whether it's being compassionate or if you're an engineer or a doctor or whatever, just what is your offering to the world in that sense? And how can you use your skills, your knowledge, your expertise, or even your curiosity to help people or to educate yourself, educate your counterparts, be there for people in whatever way that they need so that we can all come together to solve different health problems in the world. So think about what your offering is to the world and what you can do with your skills, your talents, your knowledge, your curiosity, whatever you're good at, whatever you want to do.
Nice. Cheryl?
You know, it's you guys it's sitting in such a unique spot, I think, because like for old people like me, who I think the world moved differently. The world is changing, and it is changing every day. And I think there's such great opportunity out there. And it's really just finding, I always say, find what your passion is and what you're passionate about. Because if you're building something that is going to be something that you're not really passionate about, it's not going to work for you, because you spend a lot of time, you spend a lot of effort trying to build something, and you're going to, and failing is okay. I look at failing as a great opportunity to learn from. But do what you're passionate about. And there's so much, and especially in our community, I love the fact that our people are looking at innovation as a way to not only improve the life of others, but improve their own life in their community. So go for it.
Nice. Joe?
Yeah, I mean, I'll piggyback off what Cheryl said. I think as things are changing a lot right now, there's really no better time to be a Black entrepreneur.
Mm-hmm.
I'm, as I keep track of how things are moving, not just here in the Midwest, but on each coast, we're the hot ones right now. And so I really, really hope that we're able to take advantage of that. And kind of with that, don't be afraid to dream big. Think about ideas that can be massive, that can be at scale, that can change infrastructure, change how people even interact with healthcare in the first place. When it comes to COVID-19, that's how big we're going to have to think. If you really want to talk about how to help with COVID, how do you allow people to get testing at home? How do you allow people to see their providers at home? How do you allow people to track illness even within their home, as to some of the physicians had mentioned earlier? The disease gets transferred while you're at your house,
Mm-hmm.
right? And so how are we tracking that even? So I think there's those are massive problems that are going to take massive solutions. But I think who better than us right now to be approaching those things.
Nice. Willie?
Yeah, I think mine might be a little bit more radical. And I think my big thing is that, like, none of the rules apply anymore. Everything anyone knew 30 years ago, it doesn't matter. Anything someone knew like 5 years ago, it doesn't matter. The rules have changed. And as young people, do not be scared to think outside of that like small box that we've been forced to think of, right? So this is how it has to be. None of those things mean anything anymore. Like, I think back to when I started as an engineer and I thought I should work from home, and everyone is like, you have to come into the office. It doesn't apply anymore. Someone says that, like, you have to do this. All of the have tos, that's changed. You're now at the precipice where you can create the new have tos. You are at the precipice where you can create the new normal, and that's the only way you should be thinking. Don't think like, oh, I have to do this in these certain ways, I have to get these steps. Start thinking, okay, this system has been here before. how can I rethink it? Cities were designed this way, how can I redesign it? Problems were solved this way, how can we redo it? And I think that's where like the magic is gonna happen. The magic of, being Black, being young, being just like innovative, creative, different. The moment we let go of all of the rules that have sort of been created to suppress, the joy that we can bring into the world, that's when we'll solve anything. COVID-19 isn't going to be like even a problem once we are able to rethink, what problem solving looks like. And that's sort of like my take.
Awesome. Well, this is awesome. Give yourselves a round of applause, and please, those in attendance, give them the finger snap. They're a great job. We're looking forward to them coming back, hopefully, or at least checking out some of the ideas, the blog posts at the end. So I'll kick it back over to Chelsea to close us on out. I think you're on mute, Chelsea.
Thank you so much, everyone, for all of your insight. I know some of our panelists ended up dropping off, but I'll send a closeout email as well. But thank you all for everything that you guys have shared and all of the information. I've taken all the resources from the chat and included those. I'm going to share my screen to finish out the presentation. But again, thank you so much. It was all great information. Okay. So this is mainly for participants. We've talked a lot about different things, but we're going to narrow it down to 4 different topics: educational impact, socioeconomic impact, ethical concerns, and systemic racism. So there is a link here. You'll receive it in an email, also in your participant guide, which you guys will receive later today as well. Please go in and complete the survey to let us know which topic you'd like to be assigned to, and so we can get you all put into your groups for the next session. Make sure you guys do that. To wrap up, again, thank you to our panelists. Thank you to all the participants. If you did not get a chance to complete the evaluation survey, that is here. Please do that. That's a baseline survey so that we can evaluate the actual process of the whole entire webinar series. So that's really important that all of our participants complete that. And like I said, look out for the calendar invite for the next sessions, the topic selection survey, and any updates we have about the series. It'll be via email, so just be sure to check your email. And we'd like to thank you to our partners, Goody Nation, the PHSI Department, the Morehouse Innovation and Entrepreneurship Center, and of course to the CDC, who is subsequently funding our programming. So if there are no questions from any participants, I can take questions. Panelists, thank you. Again, I can't thank you enough. You all are free to exit. If there are attendees that have